in regards to the clientele that you cater to, of course, the way that you have set up your business plan is that the cost is passed on to the patient. But perception with people in our industry is that Pinhas has high-end doctors, you know, and I commend you on that, even though the cost is not coming from the doctor, it's coming from the patient, the way that you've set it up. But within your clientele, how has digital dentistry affected them? Do you get a lot of digital files, digital impression, or are you still seeing conventional impression taking as the major contributor to your business?
We see both. I think it's equal, but going back to the statement you said, well, my clientele is a high-end, famous doctors, that's not true.
Right.
My clientele are regular, ordinary dentists. Some are just new, some have businesses, some work, most of them work averagely like 3 different labs. I'm just one of the options. And most average labs charge between $200, $250, maybe $400 if they're really good. So it doesn't make them any special. It's just regular doctors, just like anybody else, working
Right.
for a living, supporting their families. They're not lecturing, they're not famous, nobody knows about them. But for me, they're my VIP. They're supporting us, and I help them to be better. So they don't pay for my service because I teach them a trend that applied to their offices.
Right.
They don't even have to pay a lab fee. That's amazing. If you ask any dentist, you don't want to pay anything for a lab? Sign me up. I just have to teach them how to. And that's what they do. They don't care.
Right.
So they're regular doctors. They're not famous. It's not like Goldstein and Garber. We haven't worked together like for 8 years.
Right.
But even when I did work there, at the setup that I had, they had their own lab. They had a full service lab that they're using as salaries.
In-house?
Yeah,
Right.
it wasn't me.
Right.
I was just renting a space for 21 years.
Okay.
I was renting a space, and I was doing cases when patients decide to use me. If they pay my fee, I'll do it. If they don't, they use their own lab. So it was the same.
Right. Many people want to know, how in the world can you charge a doctor the fees that you charge? We've heard rumors of $1,500 to $5,000 a unit. So I'm sure it's somewhere in there, but whether it's $15,000 or $5,000, how in the world do you get that fee?
Good question. This is the best question because I think lots of people love to know that. I actually told Debbie about that, how I started. So at the beginning, when I started working independently, like my business, my fee was $150. It was modest, nothing special, $150, I was doing fine, good job. It wasn't about speed, but every dentist had the same disease. The disease was telling the patient the reason they charge such a high fees is because the lab's so expensive. So they were charging $1,200 or $1,500, blame my fee, $150. That's why they charge so much, because the lab cost is high. So it didn't make sense, and it's international disease. It's not just US, so you know, everywhere you go. So when I first came in, and I was young and I was ignorant, I said, I can change that, that's no problem. So slowly, one of my goals was, how far can I go with my fees? If they charge $1,500, I want to charge $1,500. That was my goal at the time. So slowly I increased the fee. They blame me, perfect. Double it, $300. They were pissed off at me. So they accept after a few months, cooled off a little bit, they accepted, so they added that fee to the patient. Of course, it was separate, right? $300, and they get away with it. Patients didn't mind paying $300 for a lab, plus the doctor fee. So suddenly the doctor feels like, if they pay that, that's gonna be my new fee. So we're gonna add Pinhas on top of that.
Right.
So now his fee went up because of me, so that was funny. And when they added that fee, I said, well, that's not fair because he's increased his fee, I'm gonna increase mine, so then I went to $450. And slowly I increased and increased until it came to, I think the last time we did smile design, ridiculous fee. I think it was like $4,500 lab fee per tooth.
Right.
Some interesting lady, challenging, so And that story is also in my lecture. Now, people don't believe the rumors, because rumors, everybody can make up things. Everybody thinks everybody charges a lot. You know, if you're speaking, you charge a lot. But the reality is reality. But what I do is now, because I want to inspire people that they can do it, I take pictures of checks and invoices to match it up. So I show them this is real. I'm not making this up. So I want you to know that's real. But I'll teach you how to do it. So if you're a regular lab and you want to be better and charge more, so what I tell people, first practice your skills. So watch DVD, master your skill. You charge $100, no problem. Give them the most beautiful crown you can with $100. New clients call, they ask you how much you charge. Tell them 200. If they don't send you anything, you didn't lose anything. But the new client comes in, you charge them 200. Now you already know how to do good quality. See? Another client comes, so you don't lose other clients, but in the meantime, it's a stepping stone to raise your fee. And that's what I did. I was practicing. I was doing 50 units a night, I told you. I was practicing every effect I wanted, because nobody's going to complain about it.
Right.
Right? So I got better and faster. And then when someone new comes in, ask them how much it is, and I tell them 50, 200, 300, and so on. So I increased it.
Great story. And so your clientele has the option, and as you said, they oftentimes have relationships with several labs, but they have their overhead, they have their fee already established, and then they will pass the question on to the patient.
Yes.
I can send to Lab A, Lab B, or Pinhas, and lots of clientele chooses Pinhas.
A lot. Whoever meets
Right.
me, normally they don't deny me. I don't know if it's because of
Sure.
my looks or my personality, but something. I even ask them, say, why you choose me? Because I want
Do you
to
bring
know.
Debbie with you?
No, I don't.
No?
I don't.
All right, it's all
I show
you
the
then.
picture though. I show the picture. No, but it's true, because it's funny. Because I want to find out for myself. Like everybody's is curious. So what the heck? Who would pay that? Because
Right.
the other labs are good. They're not bad labs. They're good labs. But when they meet me, I ask them the right questions. I listen to them. I think the skill of communication is the biggest key.
Absolutely.
Non-verbal communication, connect with the patient. Figure out and help the patient. Don't do it for the money. Because when I ask somebody, why do you want to pay me that much? It's like, I don't want your money. Why? You tell me first. You know, why you want to pay me? It's like, oh, this guy's like very honest, right? And I tell them up front what I see without worrying about it. They say, well, I don't want to do that. It's fine. It's your teeth. You don't have to do it. You know, there's nothing to lose. That's the attitude, and they trust me. So